Are we live?
We are live, I believe. Let me get Shay. There's Shay.
Sorry, I pressed the wrong button.
It's all good. That's how it's going to start. I think we're live. Let me double check.
It says live for 20 seconds now.
Yeah, we're live. There's nobody here, though.
Oh,
I
okay.
don't know if we're in the right one. Let's see. Yeah. Hi, everybody. There. People are watching. Welcome. It's Tuesday, right? Tuesday. Yeah.
Yep. Welcome to our live stream. We're with Halcyon Health. Today we're going to be talking about a few things. We're going to start by giving you guys some updates on the numbers. And then we're going to talk about the vaccine at length. And then we'll talk about the new variant that people are talking about. Please ask us questions. That helps us a lot to make this more personalized and get more information to you guys. So I'm Emily Scott.
James Gore.
Shay Suskin.
So maybe James can get started with the numbers.
Yeah, I'm just going to go through it briefly because I think there's a lot to talk about vaccines. I think the upshot really is in Orange County specifically. Over the past month and a half, we've seen kind of a big explosion in terms of caseload, but more importantly, hospitalization rates and ICU utilization. So the big thing in Orange County, LA County, the Southern California region in general is that clearly we're in a stage where there's a surge that we need to address. And one of the ways to address this is a vaccine. And so we've talked about this briefly before. It feels like a long time ago, but it's only been a month since we last talked about it. And a lot has changed since then regarding vaccine distribution. And so we'll talk about what to expect. We're proud to say that all of us here in the office received our first round of vaccines last week. And we'll go more into how we did that and if there were any questions amongst us about should we do it or not. It was a pretty clear answer, but we can discuss that as well and move forward. So the numbers really in Orange County, I believe in the low 500s in terms of ICUs. There's really not much wiggle room in terms of supplies. So once again, we're urging everybody to continue the precautions of distancing, masking, and now vaccines are definitely the next step in terms of getting us out of this COVID mess.
Yeah, so I think we've seen James and I were talking about this morning. What's so interesting about the numbers is we're seeing now the representation of the behavior or the exposures from 3-4 weeks ago. So hopefully now, as we are all being more careful and the holidays are over, that 3-4 weeks from now we see some decrease in the numbers. It seems right now that that's not the case, but that they're not going down yet.
Right. But we're optimistic. We're in the middle. We're always seeing 3 to 4 weeks behind us. So right now we're seeing the Christmas, New Year behaviors manifesting itself in terms of COVID. And so we'll see in a month what we're doing now.
So Shay, anything else you want to say about right now numbers?
The only thing I was going to add to that, it's been helpful for me to kind of have a date in my head and it's all estimates, no one knows for sure, but UCI has been kind of trying to estimate in terms of their hospitalized COVID patient surge, and they're predicting the peak of that is going to be mid-February, like February 12th, 13th. They've put a date on it. Again, it's an estimate, but projecting from the expectations of holiday exposures and things like that. That it's unlikely that things are, in terms of hospitalized patients and how crowded the hospitals are, that's really going to slow down significantly this month. But we're getting there, and hopefully by mid-February we'll see the peak of that, and then start to see a drop from there. So.
And my understanding is that Orange County and Los Angeles County in particular are really at a higher rate of COVID than the rest of the country. And I heard a recommendation come out of LA County today that people who live with people who are high risk should consider wearing a mask in the home. So if you live at home with someone who is over 65, over 75. In some cases, you would look at that over 75 or over 65 with a chronic medical condition. Then you might even consider wearing a mask in the home with that person if you are the person who's going out to work or going to the grocery store. So that was something that came up today, just given how common COVID is right now. So anything else on the numbers, or should we start talking about vaccines?
Let's talk about vaccines. I think I kind of teased everybody with the email in terms of when can you get it, how do you get it. So right now, just to summarize, what we've experienced is quite a 180 in terms of really having no word of how to do it and when, to literally a week ago, all of us basically just being able to access it fairly quickly. So I'll start off in saying that I'm optimistic from what I've experienced over the past week that this ramp up of distribution is going to take place quite effectively. Some main points that literally this morning was announced. Disneyland is officially going to be one of the super point of distribution centers, so a super pod. There's a plan for 5 super pods in Orange County. The big dates that Shay was alluding to that's helpful for people is that the goal really in all of Orange County to have every person vaccinated who wants to get vaccinated and needs to get vaccinated by July 4. So that's a pretty aggressive timeline to have everybody in Orange County vaccinated. And then just looking at the prioritizing people up first, I have a feeling it's going to ramp up pretty quickly. As of right now, and things could literally change while we're on here, is that phase 1A, which is healthcare workers, anybody who has direct patient care contact is able to get vaccinated as we speak, and that's how we were able to do it last week. I have a feeling phase 1B right now, which is on the timeline of starting in February, may be pushed up even sooner if depending on distribution efforts and whatnot. But Disneyland is planning on vaccinating thousands of people a day.
Maybe we can ask this question, James and Shay. So if you are, let's kind of go through it. So I'm over 75. When and how? Where do I look? Who do I call? And when do you think I'm going to get my shot?
So that's a good question. So this is, I'm sharing people the screenshot of phase 1, phase 1B, and phase 1C in terms of who these people are. So this is actually from the Orange County task force minutes of January 7th. So this is of last week, I believe Thursday. So this describes the tiers. This is all publicly available for anybody to download. And in terms of your question of
so I'm over 75. What do I do today to start planning for my vaccine? And what's your timeline? Like, what do you think? When do you think it's going to happen?
It's possible as early as next week, potentially. This is a guess, so I don't want to speak on that. So here's a nice slide from this task force in terms of how we expect this to be distributed. I just mentioned these super pods, these mass vaccination sites, which is open to the public, any Orange County resident. Clearly on top of that, people who belong to Kaiser, Memorial Care, all of these medical groups, there's an opportunity there for those medical systems to really engage and reach out to their members who are 75 and over. So it's possible that they may be receiving notifications when they're able to receive their vaccines from these organizations. And then there's these mobile strike teams and small community vaccination sites, which I'm not familiar how they're reaching out to the public and how to reach out to them, but that's part of the plan. So to your question, there's something called Athena, and we can type this in the chat box. And I sent it in the MailChimp as well, which is really open to any resident, which I actually used myself last week. And basically you sign up for it, and then they will notify you when your time is up in terms of registering. And we can share that later.
So in summary, if I'm over 75 and I don't have any underlying health problems, it's an age thing. That's who's up next as far as the general community. So what you're saying is the next step is to go to this website, which a link will give you guys, and basically go through what they say.
Right.
And then they will reach out to you when it's your turn.
Right.
And our suspicion is that this could happen within the next week or two.
Very, very possible. And then so some of the questions already popping up, using, it's Athena. and maybe
Yeah, we'll put it in the chat right now.
Uh,
The next,
Yeah, that's
the
what I'll
next-
put it in the chat right now. I'm looking at if you start on just www.othena.com, it'll get you to
and
download the app, right?
yeah, if you can if you can share that link, Shay, that would be great. And so this does not need a physician referral. There is no order that needs to be placed. This is a actually a very robust public health initiative where the age thing is actually very simple, where your driver's license or identification card that has your date of birth on it is really all you're going to need once you show up to your appointment slot, once that's widely available. Somebody mentioned this morning the current administration has pushed, HHS has encouraged the states now to basically start offering vaccines for those 65 and over. They are releasing all of the remaining millions of doses set aside for the second dose to be administered. And they're doing that, and I want to put this out there too, they're doing that with the full intent of knowing the supply chain is willing or is able to handle the second dose. So I do want to put it out there that as far as what's being communicated is that a second dose, they're confident that the supply chain is able to keep up with the second dose for people who have already had the first dose. So a lot of questions are, if we're going to release everybody to get their first dose, is that going to delay the second dose for a lot of people? We're being told that no, that they feel confident that they're going to be able to maintain the scheduling for the second dose, which is important to hear, because really this is a 2-dose vaccination effort, and 1 dose is not adequate at this time to provide the effectiveness that we're seeing from the science.
So so for people who are 65 and older, I'll ask the same question. So what should they do as far as finding the vaccine?
Right.
And when do you think they're going to get it?
So
Shay,
this is-
you
I
try
mean,
this
I don't
Oh,
know
yeah,
if
Shay,
you
please,
can
yeah.
think. What I think after, oh, sorry, can you hear me?
Yeah.
My sound is kind of being weird today. What I was thinking after, again, this is all happening so rapidly, but in the last day or two, when we're seeing that these community sites are going to become more widely available, I think we should go ahead and tell all of our patients at any age to go ahead and download this Othena app. This is likely going to be our main method of linking our patients to the vaccine. So we'll continue, communicating when the different age, tiers are available to different ages. But all of our patients should be aware of this Othena app, should go to this website now and should register themselves on there. And we hope that then the county will then, through that, push out notifications to you when it's your turn. But if not, we'll communicate to you, when it's open for you to go ahead and schedule yourself an appointment in that app, which is exactly how it worked for us last week. We downloaded it, we went through the questionnaires, we were eligible, we were in the phase where we were eligible, and there were appointment times available for us. And we're able to select an appointment time. So right, is that what you guys would
Yeah,
recommend
I think that's
to patients at this
perfect.
point?
100%.
I think everybody just should check that out.
Check out the app. So the logistics, yes. Register on that website. I don't know if you shared it or not, Shay, in terms of
Yeah.
I put it in the MailChimp and please reach out to us if you guys have trouble with that. But it's basically a registration site. And I'll speak from experience. I used the app myself last week, and you end up downloading the app. You push a bunch of buttons to verify, that you are eligible at that time to receive the vaccine. You click a appointment time slot, and then that's pretty much it. You bring your identification. I went to the Orange County Fire Authority, was where I had it. And you drive up. It was a little bit of a madhouse because it was the very first day. But I'm assuming as time goes on, all those kinks will be ironed out. We are hoping to volunteer ourselves to vaccinate people at one of these super pods, because I think that'll be an efficient use of our time to be able to help vaccinate more people. So hopefully we'll be able to do that shortly. But yeah, Disneyland is opening tomorrow, as far as I heard, with more sites as they're being announced will unfold probably in the next 2 weeks. We'll see a lot more happening.
Okay, so it seems like we got the where can I get it and when can I get it offered. And the when is, I think we're very optimistic that it's going to happen quickly. So especially for those of you in the 65 and up, maybe
Yep.
maybe soon.
Yeah. And people with comorbid, other underlying healthcare conditions.
Right,
as well.
and higher risk people.
Higher risk people.
So, okay, so then the question is which vaccines are being offered?
Moderna and Pfizer, so they're the mRNA vaccines. Those are the only two that are currently authorized. There are more down the pipeline, which we can't say too much, except for they are currently being studied, and their studies will probably close in the next few weeks. AstraZeneca, we mentioned in December. We might hear from their studies and their application for authorization in the coming 2 weeks, maybe early February, late January. That is it's a different technology and more aligned with what we're used to in terms of vaccines. Same with Johnson & Johnson as well over the coming months. But currently, as of today, those are the two vaccines that are available for distribution.
And in terms of which will be offered at the healthcare agency, these super pod sites, it seems like it will be likely a mix of both. It does not look like there's going to be a mechanism where you can choose which one you prefer. Again, this is all getting figured out. That may change, but as of now, I don't see there being a process by which you can choose. You go and you get the one that they're giving that day, right?
That's what I've experienced, and I believe you guys as well. I mean, you just roll up your arm and basically afterwards like, oh, what did I get?
Or you could ask ahead.
You could ask ahead of time. But yeah, it's not a menu, if you will, of which one you will get. And I don't know. At this point, it would be a good time to speak on that. I mean, So some people are asking specifically, like, I want the Moderna, or I've heard Pfizer is so and so better or not.
Right.
Yeah, Shay, Emily, how would you respond to that question, or your preference on Moderna versus Pfizer?
I mean, I would say, speaking as me personally, I was completely on board with either one, whichever one they were willing to give me. It's kind of funny. It ended up being kind of a 50-50 split within our office. I happened to get Pfizer. I believe James and Emily both got Moderna. Julie and Nancy got Pfizer, so we can be your guinea pigs here and see. I know Emily's been looking into, and hopefully will update us too on the specific, like what some of the different adverse events have been that have been reported in both. But the broad view of, the way they both work and the efficacy of both, those trials were on the whole really pretty similar, and I felt very comfortable getting either one.
I think what we see happening out there is the press is picking up something called subgroup analysis. So you do a study and you look at a whole bunch of people, and the intention and the way the study is designed is to just look at this big group of people as a whole, because you're randomizing people. And so you're going to end up with different age groups and different nationalities, races. People are going to be in different groups that then later get looked at after the study's done, and that's called subgroup analysis. And it's not a very accurate way of understanding the reality of the vaccine. So when people look at, for example, the data on the Moderna versus the Pfizer, and they're seeing in this age group or this race, one is more effective than the other, I would not really take that too much as the final efficacy for those groups. I would more look at the larger picture of it, and they, like Shay alluded to, they both have equal, very, very close efficacy. So I've had people tell me, oh, well, the Moderna's better for Asians, or the Pfizer's better for older people, and none of that is really well vetted enough to make those statements. So as much as you're wanting to kind of go through and make a choice, I think what you should come back to is we're going to see in the big picture as we roll this out, we're going to understand more, and what we have now is the fact that it's efficacious in a large group of people. Does that make sense?
Yeah, and I'll piggyback on that. And we've had this discussion earlier today. There's two ways of looking at this vaccine rollout. One is the perspective of the individual, right? So we're talking to you individually. What's the individual risk benefit to you in getting this versus as a population? And right now, the vaccination distribution rollout, this is really a population effort. And so the studies that have been done have shown from either 16 and up or 18 and up, and basically adults, these two vaccines are very effective in reducing severe COVID disease in people who receive the vaccine as a whole. And so if we can do that and we can vaccinate a large group of people, our county, our country, then that's what we can extrapolate those studies to hopefully similarly pan out in terms of effectiveness. And that's the big take-home point. We can talk individually the risk benefits, which is still clearly from our experience, the benefits far outweigh the risks at this time. We can talk about risks. That's probably next. But the benefits are clearly there from these studies. And really the primary endpoint, and Emily mentioned the subgroup analysis, the primary endpoint of the vaccine studies is, does it prevent people from developing severe COVID and also mortality and hospitalizations along with that. So the answer is yes, based on these large studies, and we support their distribution, and yeah.
So adverse events. Shay, you want to talk about common side effects with these vaccines, with both the Moderna and the Pfizer?
Sure. Yeah, and we've mentioned these before when we had our last webinar in December. A lot of them are going to be classic, symptoms that we often counsel about with any vaccine. We're trying to elicit an immune response. We want your body to create these antibodies. So it's normal to have some flu-like kind of virusy symptoms for a couple of days. So things like possibly low-grade fevers or chills, generalized body aches, and headaches and things like that, kind of those general flu-like symptoms. So those are pretty common. Definitely soreness at the site. All of us had that pretty significantly. And then we had varying levels of the other more mild, flu-like, mostly just fatigue. But those are all, as we've said before, those are good signs. If you have those, it's not necessarily that your body is rejecting the vaccine or you're having an allergic reaction. It's very, that's your body mounting a healthy, inflammatory response, and a good sign that you're creating the antibodies as we want you to do. So
Shay,
those are the first
thing.
Can
you answer this question that I've been asked, and probably you have too? Can you get COVID from a COVID shot?
Especially, so typically that's not how vaccines work, but especially not with this new technology, this mRNA technology. It's not like a very small amount of the virus that we're injecting you with. It's this mRNA, it's the genetic code for not even the whole virus, but the specific most infectious, spike protein on the virus. So the answer is no. We're not recreating the entire virus in your body. We're giving you the genetic code to create antibodies against this spike protein, which is how this virus invades cells and makes you sick. So no, it is this. We do not expect this vaccine to then give you COVID. Now, given how prevalent COVID is right now, it is very likely that around the time of your vaccine that you could be exposed to COVID. And we're seeing, we're definitely seeing that kind of thing. I'm just out in the community. So that can definitely happen. But, as I'm sure you understand, that's a separate issue than the vaccine itself causing the COVID-19, illness syndrome, clinical syndrome in your body. That should not happen with the way this vaccine is designed.
I think we're going to ask the same thing of Shay. So can you clarify then, we know that the vaccines do not give you COVID, but I got my shot on Thursday, I don't need to wear a mask now, right, Shay?
Right.
Or should I?
Yeah, we're definitely getting a lot of that too. And it's very tempting to feel like that. We all are feeling really great that we got our vaccines last week and we're so ready for a little bit of freedom.
But
so what these studies show it is that the clinical benefits, your reduced, likelihood of getting severe COVID did not show up until at least 7 days after your second dose of the vaccine. First of all, so for your own, protection and, will you get COVID or not? So at least 7 days after your second vaccine, you should, not think that after your first dose, you're fine and you're fully protected as soon as you walk out of the vaccination site. So that's what the study shows. 7 days afterward is when that clinical benefit really starts after the second dose. The other piece of it is, again, as James has mentioned, as we've been talking about, the clinical endpoint that these studies were looking for is individuals who received the vaccine, their likelihood of getting significantly sick with COVID. What has not been studied and what, will be studied now and what we're trying to get a handle on is how much getting the vaccine decreases the likelihood that you will be able to spread it to others. So, it stands to reason that is probably much less likely once you've developed antibodies to it and you're not getting sick yourself, that you're less likely to spread it to others. But we don't know yet. And so, so it's going to be quite a while until we can completely remove all of these, population measures that are so important right now, like the masking and social distancing, until we get a better handle on how much this vaccine really decreases your ability to carry the virus and to spread it to others. Was that confusing? Is that how you guys would say that?
Great.
Yeah,
that's exactly
great.
right.
And one thing I want to say too, I think, it happens with the flu shot too, that people say over and over again, well, I got the flu from the flu shot. We really want to set expectations. I think people think that if they have any sort of problem of feeling unwell after a shot, that means they got the disease. And so I just want to emphasize one more time that most likely you're going to feel tired, not well, sore arm for a few days after this shot. And the thought is, at least my thought is, that I'll take that over COVID any day. So just keep that in mind. Then the other question is if these, the internet's there. And so there's going to come up all these things about weird things that happen with vaccines. And maybe you guys will see those. And so I wanted to speak to a couple of things. When you look at vaccine review or adverse events reviewed from vaccines, right? You get a shot and then something happens in the next, 2 weeks, 6 weeks after the shot. They're going to report that back and watch that and see if they see any sort of increase in the group who got the vaccine versus the group who didn't. And so 2 things have come up that they're watching. One was appendicitis and another was Bell's palsy. And these were in really low numbers in these groups, you guys. So if you see this on the internet, just keep in mind that people in the general population get these things also. And so we don't know that that's caused by this vaccine. So again, when you really start to look at the larger picture, this will lead into the next question. So how safe is this vaccine? Someone asked here, why is everyone so concerned about this vaccine compared to other ones? And I'm not sure, Susan, if you meant this mRNA vaccine or this new technology. That might be what you're referring to. But so, why choose to take this when it is sort of a newer technology? Why choose to do this when there may be risks that haven't fully been elucidated because we don't have all the data yet? Because that is the reality of it. We've had, I think, how many people have gotten it now? Probably 5 million more?
I think 6 million now in the United States. I don't remember, to be honest.
So
there's a number out there.
So why'd you do it? Why'd you get the shot?
Because I don't want to have severe complications of COVID and because of the public health benefit. I think that, so one of the answers that I had given earlier in our discussion is the only way out of this is some form of herd immunity. And at this point, the best way of getting herd immunity is to get everybody vaccinated as quickly as possible versus getting everybody sick as quick as possible, which is the other way. And clearly we're paying a price right now for having too many people sick all at the same time, which is not what we want. So there's not really many answers. It's pretty simple. If you want herd immunity, you either get vaccinated or you get sick. And so those are the simple pathways.
So why did you choose vaccination over sick? Because of an altruistic, you don't want to spread it to other people?
So one that, so yes, is actually from a public health perspective, I think it's the right thing to do.
So you're
but
just
two,
a good person.
No, I'm actually not a good person. So despite me not being a good person,
You
I've
are a
still
good person.
opted to get the vaccine. Mm-hmm. But also on the individual level, my personal risk tolerance for me getting this vaccine that the studies have shown it to be effective, and the safety profile is also one that I feel comfortable with, is the bottom line that I feel comfortable getting it. And I just don't feel concerned about it.
How about you, Shay? How come you chose to get the shot? Like, what were you worried about it at all, or you just felt like this is good?
It's interesting how quick it's all changed. I mean, even early December, we were all talking about it in the office and thinking, let's let a few more people get it first. The studies do look really promising. But on the whole, they were fairly small. It's only 40,000 people or so who have gotten this. Let's let the numbers increase a little bit. And then December carried on. And then, just the way that right here in our community in Orange County, the hospitals are so overwhelmed right now. The things that we're seeing, the resources being so strained, and just the families that we're talking to every day that are dealing with the implications of people in their households being affected. I mean, just seeing the way the prevalence has ramped up in this last 6 weeks or so has changed my risk tolerance, I think, and the way I'm thinking about it. I, feel like it's now is the time, and any shot that we can take, any approach that we have to just decreasing this prevalence, we all need to, as a group, move forward and look at the greater good. I just feel like it's much more clear to me now than it was 6 weeks ago that the benefits outweigh the risk, and that continues to be clear to me as more and more people get vaccinated, and it, so far is progressing really well. And then similarly, I mean, there is also a selfish side of it too. Yes, we're, I may be less likely to get very sick from COVID, to get hospitalized with COVID, but, we're seeing now, as more time is going on, the long haul effects of COVID, even if people had very minimal symptoms while they had it. And, I just think it's not worth it. If this is one step that I can take to make it less likely that me and my family and then the greater community, all of us, are going to be affected, I think it's well worth it. And felt very comfortable getting that vaccine.
I want to echo that too. If you look statistically at the 5 million people who've had the COVID vaccine so far, or you looked at 5 million people who had COVID in the same time frame, I'd much rather take the statistics with the vaccine than with the actual disease. So that seemed like a no-brainer to me.
Yeah, we'll throw the question back at you since you asked it. Yeah, so what made you decide? In fact, it's kind of interesting. We've had this debate. There's a lot of, making sure, to Shay's point, we're being cautious a month ago, looking at the data, making sure we feel comfortable with the safety and efficacy. And out of the three of us, you get to be the first. You were the first to line up. So what made you decide?
Yeah. So same thing that Shay was saying. I think looking at how prevalent it is, how common it is here, and just the risks seem much more significant with the actual disease than they do with the vaccine, even though this is a new technology. So one thing we didn't talk about was allergies and anaphylaxis. I've had a lot of people ask me questions about, I have food allergies. I have environmental allergies. I had someone ask me, should they take Benadryl before they get the vaccine? James, do you want to speak to that a little, or Shay?
Sure. I mean, right now there's no absolute contraindication with anaphylaxis to food allergies, but there is an extended observation period in terms of making sure there's no anaphylaxis to the vaccine. From my experience, and you guys can speak to your experience as well, there's a waiting, like a waiting room or a waiting staging area for you to kind of just sit and be observed. I mean, there's just people there just in case. Something like anaphylaxis, which is a very severe allergic reaction, does take place. The silver lining, the way I'll put it, is it's anaphylaxis, when treated very timely, is, nobody wants to undergo anaphylaxis, but it can be treated very well and effectively.
Unlike severe COVID.
Unlike severe COVID. So anaphylaxis, once again, you don't want anaphylaxis if you can avoid it. No. I'm not saying that it's nothing, but the silver lining of it is there are very effective treatments that can quickly reverse anaphylaxis. So people who have had anaphylaxis from these vaccines did fine. They were treated And if some anecdotes of people who went through it would still do it again because of the things we mentioned before.
So if you what James is saying, if you have a severe food allergy, you can still get the COVID shot. If you have a severe allergy to injections or medications, you may not be able to get the COVID shot. So if environmental allergies, I'm allergic to dust, I get asthma, I have a runny nose, I eat gluten and I'm intolerant, these are all okay. You can get your COVID shot. So the time to ask the vaccine distributor is if you've had an anaphylaxis to a shot or to a medication. Those are the times you should not be getting it. So any other statements on allergies?
No, so there's a question here about somebody who was told, and I don't know from you, that because of previous allergy issues to get the Moderna versus Pfizer.
Right, so there is no differentiation between Moderna and Pfizer as far as allergies go. Again, a lot of stuff is circulating out there about one versus the other. Maybe it's just our nature. We just want to compare prices and compare and all of that. We don't have enough meaningful data to do these nuanced interpretations of one vaccine versus the other. So the answer is I believe we should treat them similarly. And if you have severe allergic reactions to injections or medications, you should talk to us if we're your doctor or before you decide to get the COVID shot. Otherwise, go for it.
And there's a question here, this is a very important point. We've already mentioned it, but it's worth repeating. Once you have the vaccine and appropriate time has passed, basically, let's say you're immune and it's effective, can you still carry and transmit the disease to others? And the answer right now is we don't know. It's reasonable to hope and suggest that the likelihood of transmission and carrying it to others is significantly reduced. But we don't know based on the data and science right now. Time will tell, so we will have better answers in a few months. In fact, one study being proposed, looking for funding to be performed in universities this fall, is designed specifically for that question. And once again, the studies that were used to authorize these vaccines really just looked at, does it prevent severe disease in people who get the vaccine? In terms of transmission, can you still catch mild COVID, all these things. There's some data points suggesting at it, but there's not enough power to make those, to give us those powerful answers yet. They're coming, but we don't have any specific answers regarding that. But that is a really good question. And that's why you're still going to see this kind of get your vaccine, but we still got to wear masks, keep distance, and abide by all of these not quarantining, but COVID measures for the near term. Anyways.
Okay.
There are a couple other questions.
That same line of reasoning kind of answers Johnny's question here right before that about the efficacy and what does 95% efficacy mean. And my understanding of that, you guys can correct me if this doesn't sound right, but that 95% efficacy, again, the clinical endpoint they were looking at is getting really sick with COVID, having significant clinical syndrome of COVID. So it does not mean that those people, 5 out of 10 people, didn't have COVID at all, like were not COVID positive. It doesn't mean they couldn't spread it to others. That was not the clinical endpoint that 95% effectiveness is referring to, is my understanding, right?
So you guys know what a clinical endpoint means? What that means is it's what you see when someone walks into a clinic. It's like what your symptoms are, like what is actually seen, rather than measuring your blood glucose, which is not necessarily a symptom. So.
And it's also in terms of these trials, it's also what is being looked at, what is actually being, what is actually being measured. And I don't know that we have data or that this 95% effectiveness refers to how many people had positive COVID tests after getting the vaccine.
That's correct. And so the Moderna trial specifically, and I don't have the study in front of me, but they did have some data points at certain time points within their study frame about COVID positive versus not. And so there was some extrapolation of maybe a decrease in transmission. But once again, Emily pointed out earlier, those were subgroup analysis. They weren't the primary endpoints of the study. And so we can't make this bold conclusion at this point that it decreases or, squashes transmission entirely. It may be true. We just don't know right now. And so that's why we're just being, cautious right now in this opening phase until we get more data. So that was that on the studies.
And like many things with COVID, we have to be patient and we have to understand that we're learning as we go. And another thing that's happening with these vaccines is we're trying to study that placebo group. And there's, James just sent us an article this morning, there's this question of ethics. If you have a vaccine that's 95% efficacious with this pandemic disease, and you live in a place where it's everywhere, and you're the placebo group from the study, you want to get your vaccine. So there may not be a placebo group to watch for the long run with these shots. So we may never really know the details of placebo versus active for this, understandably. So what we're doing is the best that we can, and we're watching and waiting and seeing what happens.
And there's an urgency I do want to highlight and we've seen this operationally in terms of policy, whether it's the president, the administration, as well as local public health, that there is an urgency to get people vaccinated quickly. And Emily alluded this earlier, there's variants that are popping up throughout the world that we are keeping an eye on. And the reason is, those variants are potentially more transmissible. And so the quicker we can get people more vaccinated, the more we can really get a handle on this. So there is a little bit more urgency than, wait and watch and let's see where this goes. And that's why we are being very, advocates of really helping people get vaccinated as soon as possible. So and you can talk more about that in a minute.
Well, speaking of which, what if you've already had COVID? Mm-hmm. If you've had COVID, should you get a vaccine, and when? I don't know if you guys want to answer that or if you want me to answer it.
You can answer it. You talked briefly about it. But short answer is yes. You should get vaccinated.
Yeah, you should get the vaccine.
And somebody mentioned that they got one as well. They had COVID and she got the vaccine. So
right. She had the symptoms and it scared her. But I bet she can attest. Maybe if you're still out there, Mindy, you could tell us which was worse, COVID or the vaccine. So if you've had COVID, let's say just you had asymptomatic COVID that was never diagnosed and you never knew it, and then you took the vaccine within a week, or at the time you took the vaccine and you had COVID, it is not dangerous. This is not a dangerous thing to do. You do not need to worry about that. The thought is if you've had COVID, most likely you have some immune protection for at least 90 days. And so the recommendations have been that you could wait 90 days after having active COVID or being diagnosed with COVID to get your vaccine. And that might be a little bit about resources too. If you've had COVID, maybe you can save that shot for someone else and give yourself that time, because if you had COVID and your neighbor didn't, and your neighbor gets the shot, then you're all going to be better off in the long run, because both of you will be protected in the long run if nobody gets it anymore.
Yeah, so that's a good summary. And then talking on that too, I guess some questions about other vaccines. We actually have encountered this from other patients in our practice where, there's a shingles vaccine that you need, timing of other vaccinations. So from the CDC, 14 days, if I remember correctly, please correct me if I'm wrong.
So what they said,
between the vaccinations.
They said if you have a choice, right? Like, let's say you got your shingles shot last week and now you're offered a COVID vaccine this week. Just do the COVID vaccine. You don't need to be like, no, I can't get it because I just got my shingles shot. Like, just do it. Don't worry. Just go for it. The recommendation was if it's just a routine vaccine, maybe you wait 14 days after they've gotten their COVID vaccine to give them a routine vaccine. That's all.
Right.
So it shouldn't, again, none of this should hold you guys up. If you had a routine vaccination in the recent past, you don't need to wait to get your COVID shot. Please go get it and get yourself covered.
And there's a question that we can dovetail into the future maybe, like, is this likely going to become like the flu? Are we going to get a COVID shot every fall?
It'd be good to talk about the variant.
Yeah, that's kind of a way. I think that leads into...
Well, there's one more vaccine question that I thought was a really good question, and I actually don't know the answer to it, that Britt asked earlier, that I'm going to see if you guys have come across this. I'm sure we will be coming across this in terms of the timeline. So So we know that the Pfizer vaccine, the interval between the two shots is recommended 21 days and Moderna 28 days. What if longer than that? And I'm sure this will, come up as logistically everybody needs these two doses. How long is appropriate to wait if you can't get it exactly at 21 days? Are there guidelines for what's the how long is too long of an interval between the two doses?
I don't know if there is a guideline on how long is too long. It shouldn't prevent you, I guess at this point, if you've missed your 21, 28 day appointment, the next available that you can get, you should still get. I don't think it needs to restart, meaning that isn't the first dose. But that is a good question that I don't have a specific answer to. I don't think there's guidelines on that just yet in terms of, if it's been 60 days, then it's dose 1 versus dose 2. I don't think we've gotten to that point yet. I guess the bottom line is, don't be disparaged if it's 22 days or, a week later, like, oh my gosh, it's all doomed. I wouldn't think about that. If mine was delayed a week, I personally wouldn't be concerned. I'd get my second shot and call it a day. I guess that's my short
answer. And I don't know if we're going to know that. Sorry about that. I don't know if we're going to know the answer to that until for a long time, because that wasn't what was studied. What was studied was that time differential. And so it's happened with other vaccines, and we do the best we can and we see what happens. So
yeah, and there's another question about vaccines specifically. You don't get to choose your shot, so do they make sure you get the same one on the second shot, or it doesn't matter? It does matter. Yes. So whatever you get first, it is documented. There's actually a public database where it's all documented. So whatever shot you get, you have to get the same one. So if you get Moderna the first shot, you have to get Moderna the second time, because that's how it's been studied, and that's what we know the safety and efficacy to be in terms of getting those vaccinations. So you should get the second one to be the same one, and that should be it's organized in a way that you don't have to think about it. It's written down, and it should be part of your scheduling.
All right. Anything else on that, you guys? Are we going to offer the vaccine in our office?
Not at this time. Logistically, it's not something that we're able to handle here in our office. We do hope in the future, once it becomes more widely distributed, that we will offer it to the public, as well as probably it being a different vaccine that's just easier to store and easier to kind of just deploy. At this time with Pfizer and Moderna, with the freezing requirements, as well as just the overall need in the community, I think focusing our efforts in getting people to these really efficient distribution centers is the best way of handling it, and as well as us volunteering our time to help vaccinate as many people as possible is the ideal setting, at least for us in our practice.
Yeah, we thought real hard about, can we get it here, and can we give it to our patients? And what would happen is we would go into a database, and we were concerned that might flood our phones, and then that would be all that we're doing is answering calls about the vaccine.
Yeah, we can't manage that. So once you're a distributor,
then we'd have to hire someone just to answer the phone to tell people that we can't give the vaccine to everybody. So we don't want to take away from our ability to care for our patients and keep ourselves available to you guys, which is why we've decided at this point to really just volunteer when we can out at these super pods to help everybody in the community get the shots. And then as things roll on, if it's easier for us to get it here and it feels like we're not going to get overwhelmed by it, then we of course want to offer that to our patients, and we'd rather have you come here than drive to some super pod. But right now it just didn't seem like it was going to work out the best for the way our practice works.
Yeah, logistically it just I just don't think it will work out for us to be able to distribute it here in our practice. But once again, I think later down the road it will be, once it's more widely distributed and the resources are far more abundant for us to be able to handle that and bring it to you guys.
Michelle asked if there's any medications that interfere with the effectiveness of the vaccine.
I don't recall.
So the only thing I've read about is that concern that people who are on immunosuppressive medications, so if you have autoimmune disease and you're on an immunosuppressant, for example, like a steroid or methotrexate or these other medications that suppress immunity, Humira, there's a lot of them. it's not dangerous. It's not like you're going to get the shot and be injured. It's more just that you don't have the ability to mount an immune response because you're taking a medication that squashes your body's ability to make the antibodies, which is the whole point of the vaccine. So that would be one thing. Another would be if you got a monoclonal antibody treatment for COVID, you have to wait 90 days because now you've got, you're going to make the protein in your body, and then you have antibodies that were injected into your body that are going to squash the protein, and then it never creates this natural immune response. So that's another thing, just monoclonal antibody treatments, immunosuppressive treatments. Again, not worried you're going to get the shot and like just something bad's going to happen to you, more just that you may not mount as good of a response as someone else might, and so the vaccine might be more useful in someone else's body.
And I don't think we've had anybody with monoclonal antibody treatment at this point. It's somewhat rare, but yeah, that is a good point in terms of making sure
Some
you wait.
people who have been hospitalized,
yeah, hospitalized.
with COVID
Yeah.
have
Luckily,
gotten it, so.
we haven't had too many people through that.
Yeah.
So that's good. And then another question about what happens if you get the two different shots, Pfizer and Moderna. The question, I don't really know specifically what would happen necessarily, but that's just not what the studies haven't intended. So we don't know the outcome. So in terms of efficacy, it's just not known whether or not getting two different vaccines would be effective. And so you're kind of in a point where we just don't know. So that's why we wouldn't deviate from what was actually studied.
And my mom asked a question that I love because this brings up a point that we will say again and again and again. Things like ibuprofen, Tylenol that are used to help you feel better are not going to make you get better faster from a viral illness because it suppresses your body's natural ability to fight it. And so in that same light, you don't want to, if you feel like you can handle it, don't take ibuprofen or Tylenol before your vaccine or after. If you are miserable and suffering and you're so uncomfortable, it's not the end of the world. You can take them. But if you have a choice in the matter, don't just pop the Advil. Wait on it and just kind of let your body do what it needs to do so you can mount an immune response. And that goes with any viral illness that you get. Anytime you get sick, if you can, again, I don't want everybody to suffer tremendously, but if you feel like you can bear through it, it's probably better to let your body make a full immune response.
Yeah, fever in of itself is not a bad thing. It's your body's natural way of having an inflammatory process to fight something or mount an immune response, which is what the vaccines are doing. So I agree.
And that
100%.
is sort of, that's not the same as these immunosuppressive medications. Like if you take ibuprofen, it's not like, oh my gosh, the vaccine's just not going to work at all for you. It's just, it's something small that may make a small difference, but it's not the same as being on Humira and getting the shot.
It's not a big deal. Correct.
Yeah.
Right.
Great. Okay.
The new variant. So this new mutated COVID. Is the vaccine going to work? First of all, Shay, you want to talk about that? Will the vaccine still work, or do you want us to talk about it?
Well, I think it's promising that you probably have looked more into studies on it. Just reasoning through it, I think it's likely that this vaccine will still be effective. The way this vaccine was designed, which we've talked about before, was pretty brilliant in that it's eliciting antibodies specifically against this one protein, this spike protein on the virus that is the way that the virus invades and attaches to cells. And so it seems unlikely that spike protein is going to mutate. Other pieces of the virus, other proteins, other pieces of the virus might mutate, but that spike protein, it seems likely that it will stay consistent through mutations because that's one of the primary, ways that it infects people, that it gets into your cells. So I think it's promising, but I think we don't know. That's the way I would answer that, just kind of reasoning through it. But what are your thoughts?
The idea is that it'll stay consistent enough, right? So when it mutates, it does change some parts of the spike protein, but that the current mutation hasn't been this dramatic change from what it was before, right? And the analogy I use is like thinking of a color scheme. So if you have like something that's red, green, and black, and it mutates to black, green, and red, it's still the same colors. It's still, your immune system can still kind of see like, well, this isn't brand new. And so it still works pretty well. We don't know if it's going to be that 95, but there's all the reasons to be optimistic about it. And it definitely isn't going to be like a brand new start with COVID, right? Because COVID, that would be like going from red, green, black to orange, purple, yellow, right? It'd be this complete shift to a completely new spike protein that's like completely novel, which is what got this all started in the first place. So I think for that reason, even though it might change the efficacy slightly, the scientists are hopeful that it won't be a start over, like a complete do-over where we're going to see the hospitals piling up and people dying every 8 minutes like they're saying right now.
Yeah, I mean, cautiously optimistic based on very preliminary. I mean, we just don't have that much data right now, but you know, what Emily and Shay have been saying is that, yeah, there's a broad enough, these vaccines will be providing a broad immune response to the spike protein that's been delivered, as well as other ways of addressing the spike protein that the mRNA is making. You know, what's this going to look like 6 months from now? We have to wait and see. It's uncertain, but right now we're optimistic. It seems that it's still effective. We don't know the percentage, like you said, but it's still effective, and right now we're aware of it. And this is not a surprise. Another thing too, this is not something anybody was shocked by, but we just have to keep an eye on it. And people, you know, in Ireland and the UK, their numbers are going through the roof. This is where the urgency now is of that we mentioned before, of really vaccinating people quickly, because if indeed, which is what it seems to be, which is just more transmissible by whether it's 40%, 50, 70%, 70%, it's really urgent for us to get on top of it in order to prevent what you said in terms of not necessarily getting sicker. And this is the point actually we should make now, is that these variants are not showing at this time on an individual level to put you at higher risk of getting sicker. What it does show is it's just able to spread to more people more easily than the prior strain or prior variant. And so vaccinating more people, and now because it's potentially more transmissible, now vaccinating even more people than was initially projected becomes even more important. So that's why you're seeing a lot more really aggressive policy changes to get people vaccinated quicker.
And that kind of goes into this question of, will this become like a yearly thing? Like we have a flu season, we have a COVID season. We might. And when you think about, so going back to my analogy about the colors, so when we had our influenza pandemic 100 years ago, that was like a brand new color scheme, right? We had never seen this type of influenza pattern before, and it was devastating. And now every year, you know, let's say it was orange, green, and blue back in that first pandemic. Now it's some variation on that, but close enough to it that we've kind of seen it before. And so it's not like, you know, 3 million people die from the flu. It's 60,000 people die from the flu. So, you know, it's possible that moving forward that COVID does look like that, or maybe the proteins are more stable than we realize, and it's like we get that vaccine, and even though there's a little variance, it covers it really well for the long run. It could be either of those scenarios, and we don't know yet, and we won't until it happens. So that's kind of like where our science reaches its limits. We have to see.
Yeah, that's true. And then a question, I know we're kind of wrapping up shortly.
Lots of good questions.
Yeah, COVID in kids. There has been some small data points maybe suggesting that, but it's way too early to say whether or not these new variants are, I don't know if you're even asking about the variants or just us in general seeing more COVID in kids.
The new variants are affecting the kids.
Right. So yeah, it's possible. Once again, too early to call and make a lot of sweeping decisions yet. I think continue what we're doing.
Part of the reason it's just, I'm so excited for everyone to just get their shot. I'm so glad that, you know, it's a tricky choice, but made the decision to just release all the vaccines, just get everybody vaccinated, because if we can get this into people fast enough, then we can avoid this new variant, which might be more contagious in kids and might, you know, it seems to spread easier. From just becoming part of our lives.
Yeah. Well, it's again, we just don't know the answers to that just yet. Maybe next time we speak, we'll have a little bit more data. But right now,
Jan asked one question about medications. Mm-hmm. Should we stop our medications before getting the vaccine? No. Take your medications. Don't stop your medications. long-term chronic medications are fine. When I was speaking to that, I was only talking about like Tylenol, ibuprofen, these over-the-counter pain reducer, fever reducer medications.
And I was thinking of that, like aspirin, even for our patients who need to
Right.
be anticoagulated, who have cardiac conditions or have been told, don't stop your aspirin.
Please
This
don't.
isn't a good enough
And if
reason
you have a
to
question,
stop that.
just let us know. Yes, but generally, no, don't change or stop anything. Is a good general answer for that. And
Yeah.
then there's another question about vaccination record. I did receive one from CVS. Somebody got it from CVS, so it got forwarded to your chart. But if you have, and feel free to forward it to us. It may not be automatically forwarded to our office for our records, so we'd be happy to get that either way. I think that's kind of about it for now. We'll have more things to share probably in a couple weeks. Well, I guess we'll aim to do this again to connect with you guys and see, and maybe, and clearly we'll communicate with everybody when there's more news about, difference in phase changes to get vaccinated.
Yeah, and the logistics. I saw a lot of people comment earlier that they were trying, once we put that link up to go ahead and create a profile in Athena, it wasn't letting you do it yet.
So that's right.
So
And so I'll speak to
it's
that.
changing by the minute.
So if the Athena app's not going to work for just the app itself, if you download it, you're not going to be able to get on. And so they're asking people to do is just register on the website, put your email and all of your information. Downloading the app is a separate process that it'll get activated once you receive a code. So this is what happened with me when I went through it. Registering first, you'll get an email. When you download the app, then you'll be kind of activated on the app. So downloading the app will not really do anything. But going on the website, the Athena website, and putting your demographic registration info should be the first step for everybody.
And then this is your ticket to get back into Disneyland this year. Go get your shot.
James is going to get his second shot while riding Splash Mountain.
I changed it to teacups. I think teacups
Oh gosh. Well, thank you guys. It sounds like we had a lot of good questions today. Thank you so much for coming and for commenting. And we'll look forward to talking to you guys again soon.
Till next time. Bye.
Thanks, everyone.